the symptoms associated with placenta previa?
So typically, most women don't know they have a placenta previa until they find it on ultrasound. The most common symptom with a placenta previa is painless vaginal bleeding. So often a woman in the second or third trimester will come in with painless vaginal bleeding, we'll do an ultrasound, and at the time of the ultrasound, we'll diagnose the placenta previa.
And sometimes this can be a little scary because they might think there's something going on with the pregnancy. Is this a sign of a miscarriage? But it's not always the case.
Correct. So very often it's self-limited. It will just occur. You'll have a small amount of bleeding. It will resolve. But if you have a placenta previa, you're at very high risk of having recurrent bleeding during the course of the pregnancy. You're at very high risk of having a premature delivery because of complications and continued bleeding.
Now, based on this information, does that immediately mean bed rest for the rest of the pregnancy? How are things adapted?
It varies. I think it's an individual decision. It all depends on how you're doing. So for the first episode, it's a small amount of bleeding. We tell you pelvic rest, no relations with your partner, no vigorous exercising. You know, you can go out to dinner, you can go do your daily chores. If you have significantly more bleeding, then we will put you on bed rest. Or if you've had several episodes of bleeding, we will put you on bed rest for the remainder of the pregnancy.